Appendicitis. Symptoms, causes, and natural home remedies. The appendix is a finger-shaped pouch that projects from your colon on the lower right side of your abdomen. Appendicitis is the most common of all serious intestinal disorders. It refers to inflammation of the vermiform appendix. It presents itself in acute and chronic forms and affects both the sexes equally. This disease now accounts for about half the acute abdominal emergencies occurring between the ages of 10 to 30. It is more frequent in developed countries than underdeveloped countries. In this video, we'll explain what appendicitis is, what its symptoms are, and how to find relief from appendicitis using home remedies. Before we go any further, if you're new to the channel, hit the subscribe button and the notification bell so you don't miss another video. We share tips on how to stay healthy every week. Signs and symptoms of appendicitis may include right side of the abdomen that is tender to the touch, sudden pain that begins around your navel and often shifts to your lower right abdomen, pain that worsens if you cough, walk, or make any jarring movements, nausea and vomiting, loss of appetite, low-grade fever that may worsen as the illness progresses, constipation or diarrhea, abdominal bloating, flatulence. Causes. Appendicitis is caused by a toxic bowel condition. An excessive amount of poisonous waste material is accumulated in the calcium. As a result, the appendix is irritated and overworked and becomes inflamed. It is an attempt on the part of nature to localize and burn up the toxins. This condition is brought about by wrong diet and innervation of the system, inflammation of the bowel lining due to the habitual use of apparent drugs is a potent predisposing factor in the development of appendicitis. Further inflammation and infection comes from certain germs which are usually present in the intestinal tract. Are you enjoying the video? Be sure to leave a like and share it with your friends. Treatment. The patient should be put to bed immediately at the first symptoms of severe pain, vomiting, and fever. Rest is of utmost importance in the treatment of this disease. The patient should resort to fasting, which is the only real cure for appendicitis. Absolutely no food should be given. Nothing except water should enter the system. Low enemas should be administered every day for the first 3 days to cleanse the lower bowel. Hot compresses may be placed over the painful area several times daily. Abdominal packs made of a strip of wet sheet covered by a dry cloth bound tightly around the abdomen should be applied continuously until all acute symptoms subside. When the acute symptoms subside, by about the 3rd day, the patient should be given a full enema, and this should be repeated daily until the inflammation and pain have subsided. The patient can be given fruit juices by the 3rd day onwards. The simple treatment sensibly applied will overcome an appendicitis attack. After spending 3 days on fruit juices, the patient may adopt an all-fruit diet for a further 4 or 5 days. During this period, you should have 3 meals a day, each meal of fresh, juicy fruits. Thereafter, you should adopt a well-balanced diet based on 3 food groups, namely seeds, nuts and grains, vegetables, and fruits. In case of chronic appendicitis, a short fast should be followed by a full milk diet for 2 or 3 weeks. In this regimen, a glass of milk should be taken every 2 hours from 8 a.m. to 8 p.m. on the first day, a glass every hour and a half the next day, and a glass every hour the third day. Then, the quantity of milk should be gradually increased so as to take a glass every half hour, if such a quantity can be tolerated comfortably. After the full milk diet, the patient should gradually embark upon a well-balanced diet, with emphasis on fresh fruits and green leafy vegetables. Certain vegetable juices, especially carrot juice, in combination with the juices of beets and cucumbers, have been found valuable in the treatment of appendicitis. Regular use of tea made from fenugreek seeds has also proved helpful in preventing the appendix from becoming a dumping ground for excess mucus and intestinal waste. The patient of appendicitis should adopt all measures to eradicate constipation if it is habitual. An abdominal massage is also beneficial once the waste matter has moved into the colon and then eliminated. Irritation and inflammation in the appendix will subside, and surgical removal of the appendix will not be necessary. The surgical operation should be resorted to only in rare cases when the appendix has become abscessed. Have you experienced appendicitis? How did you treat it? Be sure to comment below.